as we go forward the next 30 to 40 years, the population over the age of 65 will effectively quadruple. And if you look at healthcare, healthcare is predominantly delivered to people as they get older. So it's not just a simple supply and demand situation. We're going to have a blossoming of demand, but at the same time we have fewer doctors and fewer nurses available. It's no longer palatable for students to go into healthcare because the system isn't designed to make their life easy. So we're going to have a challenge where not enough doctors, not enough nurses, 4 times the size of demand. How do we deliver the healthcare? And the problem has always been healthcare has been delivered in a one-to-one manner. We've always had a situation where the patient came to the doctor treated the patient, and the patient went back home. And the solution really is to integrate healthcare, communicate more effectively with the patient back in their environment, make them an active part of their own healthcare.
So how do you do that?
You provide them with tools so they understand the consequences of what they do, the treatments you're currently giving to them, and keep them constantly informed in the loop.
So give me an example.
Practical example. Say take an 80-year-old at home who's got her heart's a bit off, her lungs are a bit off, she's had diabetes for 20 years. In the past, that patient would see a diabetic specialist for her diabetes, a lung specialist for her lungs, and a heart specialist for her heart. And then all 3 of those would have their own separate bits of information, and it would be up to the patient to try and work out how to make that all work. In a well-communicated world, there's now a team looking after her, and she's actually actively involved in the team. She has devices in her home which measure her blood sugar, trigger alerts when things go bad, devices in the home which will measure her lung function, devices in the home which measure her activity.
But when you say a device that measures her lung function, isn't that a huge machine that goes beep?
Well, 20 years ago it was a huge machine that goes beep, but now it's a $25 piece of equipment where she blows into. So the technology is becoming more and more easily available, but also understanding the relevance of that information. So the fact that she takes 30 seconds to climb the stairs when she normally takes 20 seconds to climb the stair is clinically important information. The patient understanding that there's been a change in those numbers are relevant for her. So those are the sort of information we want to capture.
And are you saying that it will be a higher standard of care?
It'll be a higher standard of care from 2 perspectives. One, the patients will stay in their homes, in their own communities. So if you speak to the average 80-year-old in a hospital, they hate being in hospital.
If you speak to the average any-year-old in a hospital?
Absolutely. I mean, you speak to some of the doctors who work in hospital, they hate being in the hospital. But
you know that because you were one.
And I was there. But once these people realise they can actually do more about these things at home, but provide them with the tools to do it. Don't just throw them out there and say, look after yourself, but provide them with tools which provide them with the education in context, with communication with their care providers in context.
So what were a tool that provides them with communication with their care provider? What do you mean by that?
Okay, so a great example there, we did a program a few years ago where we provided a very basic video conferencing tool into patients' homes. And once or twice a week, the nurse who would come out to visit that patient would have a 2 or 3 minute video conference with that patient, ask them very specific questions. Mrs. Smith, how have you been? Have things changed? But the fact they can have a very short, sharp conversation in that person's home versus the old model of they would have to wait either for the nurse to arrive or more often they'd have to arrange for one of their family members to get them to the nursing clinic, all that stress that's associated with that, we found that continuous communication was a lot more effective.
You still have the basic carer-care-needer ratio is skewed, and you also have people now having to learn devices and buttons and technology. So we have an army of virtual people, virtual nurses waiting to step into these ranks and free up nurses to do real human stuff like talk to patients instead of basic monitoring and basic lifestyle management. And there's a lot of science there. Now we those of us that are in the virtual person space, we know that we're already able to have conversations at least at the quality of humans and often better than.
How?
We have endless patients. Virtual people are now a fully fledged...
What does a virtual person look like?
Okay, so I'm not talking about robots that are metal and go bleedy, bleedy, bleep, beep, beep, blop. I'm talking about 3-dimensional characters that can live in a smartphone or on a machine and they actually talk to you.
Hello, Liesl, that sort of thing?
No, much better, okay. There's a study out of MIT. Basically, they administered a chronic diabetes and weight management program to people on a web-based system, and another one was delivered with a robotic creation. And the staying power was twice as long with the robot. People were giving it names, dressing it, personifying. We've seen this. We've had millions and millions of chats with virtual people. We're in big companies like HP, National Australia Bank, and these are not something that's coming 10 years from now. They're really able to have intelligent, meaningful conversations.
Okay, so give me an example of how they can assist someone in achieving a better health outcome.
Okay, so you have a virtual person who's your health coach. So you go, hi Mary, how are you going today? Have you done your exercise yet? What's your blood pressure? Mary, that's exactly the same reading you gave me last time. And we found about between a 70 and 90% acceptance rate where people will talk to it as if it's human, and they'll actually talk to virtual people twice as long as they talk to human beings.
Fadi, have you got a comment on some of the things you've seen?
Yeah, I mean, this example of patients like me is a typical example of inclusion, whereby the feedback that is circulating around those patients will actually speed up the data that you need in terms of new drugs being introduced, any new symptoms coming out of it, does it really help me? The connectivity will lie at the heart of such collaboration. Also, some of the examples that George was alluding about, the digitization of scans or imaging, that you can now transport outside your home and the hospital. With the way the mobile networks are evolving, you can actually have now speeds and bandwidth that are capable for you to, let me give you an example, breast cancer screening. If you might have that machinery in a bus, which is circulating around out in the villages and rural areas, maybe the nurse will come up across a case which is not very easy to diagnose. But with mobile broadband, she can actually connect back to the specialist in the hospital, in the city, actually transfer over the actual scan and have a video conference to discuss that particular case while the patient is still there in the van. So I think we are seeing a lot of new applications that are possible to be done today.